bring in Dr. Anahita Dua, founder and chair of Healthcare for Action and also a vascular surgeon. Doctor, good morning to you. Thank you for your time. I imagine you watched RFK Jr. testify in those doubleheader hearings yesterday. As a physician, what was your headline moment from his testimony?
What was most interesting about his testimony, at least for us, is that he really is trying to shift the narrative, which is kind of classic, unfortunately, of this administration. They've seen what's not popular, as was said earlier, and tried to move the conversation away. As you pointed out exactly, he didn't mention vaccines at all in the opening statements. The Democrats really didn't let him get away with that because the accountability aspect is really key here. And now he's trying to have a conversation about budgetary cuts, trying to explain that what's happening in the United States is acceptable. And he's just fighting because no one is allowing him to forget what he was saying previously.
There is reporting from our partners over at the Hill, Doctor, that with an eye on midterms, you know, to Brooke's point that she just made, the White House wants Kennedy to stop talking about vaccines, focus on other MAHA wins instead. You know, in those opening statements, we saw him touting new dietary guidelines, drug pricing, partnerships with companies on artificial food dyes. Just elaborate on what more that told you that he tried to pivot away from vaccines every chance he got.
Well, the interesting thing about it is that they would consider those wins. You know, a win is all about measurable outcome, which as the HHS secretary, he should know. And you need to be able to actually say that I made this change and this is what actually was the impact, which is, of course, impossible. You know, so it's interesting, you know, you talk about food dyes on one hand, which is a minuscule thing compared to children dying of measles, which is, of course, what happened under his leadership over the last year, which essentially was eradicated in the United States, you know, up until January, until there was this explosion that we saw, and you saw that contentious back and forth. So what that really tells me here is that the wins, quote unquote, are very small and frankly negligible compared to the massive losses. And now that we have to kind of regain ground because we have these losses, budgetary cuts really make absolutely no sense. So I think this poor guy is fighting a fight he can't win and having a discussion about something that doesn't really make sense, certainly to the medical community and for public health.
Now, he was obviously grilled on vaccines. Multiple lawmakers, you know, brought up measles and, you know, the numbers of those who have died, including children. His argument to that was that the distrust started after COVID and that the distrust and patients not taking up the measles vaccine didn't have anything to do with the changes he has made in the last year. What's your response to that?
Oh, that's complete nonsense. There's data showing that that is nonsense. The COVID vaccine and the COVID story is its own entity and has always been. Even in terms of the Trump administration itself, they have also separated the COVID vaccine from other vaccines, which is why they're now saying things like, actually, the measles vaccine is a good thing, but haven't said anything like that about COVID. And so that kind of fits into the us and them narrative that unfortunately RFK has been touting, because that, of course, you know, sounds great on a podcast that allows you to get followers. But in reality, the accountability that comes with creating distrust in the medical community is something that he's not faced until now. And that's why he's having such difficulty, I think, in these hearings, because he doesn't really have an answer beyond the little sound bites that he has been giving historically.
And that us and them narrative exists also for every lawmaker in Congress, too. We see that from both sides. I would be remiss to let you go without asking you about budget cuts. Those were also front and center yesterday, including the National Institute of Health budget being cut by $5 billion. Kennedy suggested that the cuts didn't meaningfully affect scientific outcomes. I mean, in your eyes, what does a nearly 13% cut to NIH actually mean on the ground and research and our health?
What it means is a person today who's diagnosed with a particular cancer or with Alzheimer's 20 years from now is not going to get the care that they need to survive. That's what it actually means. There's no question that budgetary cuts to the NIH, which was already underfunded to begin with, is going to have massive impacts, because it's not just about the economy in the scientific sense. It's not just about the fact that there are researchers that are not now going to get paid, that are not going to go into the disciplines that are going to allow us to get the appropriate medical care. It's also about issues with like public health. The NIH does a lot of things that the public doesn't really know about. And unfortunately, with these budget cuts, we're not going to be able to see the progress that otherwise would put America on the center stage. So it's not just about patients. It's about everybody. A country is great when when the economy is great and when the science is great. And both of these things are going to get hit hard with these budgetary cuts.
Well, he's back for round 2, or technically, I guess, round 3, I should say, on Capitol Hill today. We'll see what more we learn and what more he shares. Dr. Anahita Dua, thank you so much for your time, ma'am. Appreciate it.
Thank you. Thank you.
Well, the war with Iran and the